I'm Dr. Perlin. I'm the Executive Director of the Public Health Research Institute. I'm also a Professor of Microbiology and Molecular Genetics at New Jersey Medical School, and I'm also the National Director of the Rutgers Regional Biocontainment Laboratory. My specialty is in the diagnosis and development of countermeasures to overcome antibiotic resistance. In the era before antibiotics, so before the 1940s, the leading cause of death worldwide was infectious diseases. If you had a respiratory infection, a bacterial infection, you were most likely to die. If you had surgery and developed a staph infection, you were most likely to die. Probably 50% or more of all infections resulted in death. And we had no way to deal with these infections. You had to rely on the host immune response. And so it was 50-50 whether you would survive. The development of antibiotics changed that dramatically. Antibiotics changed medicine. It allowed modern medicine to be what it is today. The key for us is to be able to preserve the antibiotics that we have. We have very few classes remaining of antibiotics. There are very few companies now that are engaged in making antibiotics. And so our window is quite narrow to be able to effectively treat patients. And if we don't take seriously the problems that we have with antibiotic resistance and we don't intervene, then we're going to have very few drugs left, if any, and we could easily revert back to that period when we had no therapies available. It's an extreme situation, but it's not inconceivable if we continue to use antibiotics in ineffective and inappropriate ways. We have to preserve them, and that means that we have to use them for the medical purposes they are intended for. We have to stop using them, for example, in agriculture where they're not appropriate, and we have to educate people to understand how to take their medication appropriately and not risk developing resistance.